So your days of menstruation is directly related to your menstrual health, because there are standard days that we expect a normal person, if you're a lady without any issue, we expect you to menstruate within a certain number of days. So if you menstruate, let me say below a certain number of days, if you bleed, if your bleeding is below a certain number of days, then it is possible that you have an issue that you need to address. Now, if you also bleed above certain number of days, then probably there are also some issues that you need to address in terms of your health. So if you're just joining, work home, please. How many days do you bleed? How many days do you see your menses? How many days? The 1, 2, 3, 4, 5, 6, 7 days. How many do you see? How many days do you see your menstruation? That's what we are asking this evening. And if you're just joining, welcome. Thank you so much. Please don't forget to share this video. So like I said, your menstruation, in terms of the number of days, in terms of even how heavy your menstruation is, in terms of even how light your menstruation is, tells you a lot concerning your own health, concerning your menstruation in general. So if you bleed heavily, and that's how you've been bleeding maybe since you were just 15 or 13, or since you started bleeding, you were really bleeding that heavy, right up to now that you are 24, you're 25, you're 18, you're 20, you're 30, you are still bleeding that heavy, then it could have been that is your own way. But your menstruation, your bleeding days, has a lot to do with your menstrual health, your menstruation in general. Sister Princess Elsie Dreader. Elsie Dreader, welcome. Thank you so much. I want to welcome you. Thank you for being here. Thank you so much. So if you're just joining us, welcome. Thank you so much, sis, for supporting a colleague. Thank you for being here, bro, sis. So I really want to appreciate, please, if you're joining, if you could help share this video, it will help a lot. Thank you so much. So we are looking at menstruation. We are asking, Sister Tina, welcome. Good evening. How are you doing? Thank you so much for being here. Okay, you're asking a question that what if someone bleeds for 3 days but the flow is too heavy? Okay, so you bleed for 3 days. Do you bleed for 3 days, please? Because it's a question. I just want to know, how many days do you bleed? I'm asking everybody watching, if you're a lady watching, how many days do you bleed? Do you bleed for 1 day, 2 days, 3 days, 4 days, 5 days, 6 days, 7 days? How many days do you bleed? Because like I said, the number of days which you bleed as a lady is directly related to your menstruation hygiene, to your menstruation health, right? It's directly related to how your own health as a female is. So if you bleed for 2 days, if you bleed for 7 days, if you bleed for 9 days, if you bleed for 10 days, if you bleed for 1 day, so depending on the number of days that you bleed, this is directly related to your menstruation health. So it is important that you know. So how many days do you bleed? Sister Tina, do you bleed for 3 days? Okay, so you bleed for 3 days. Okay, that's cool. I'm coming to your question. You're asking that you bleed for 3 days, but it's too heavy. So please, if you're watching us, please just help share a video, and good evening to you. How many days do you bleed? How many days do you bleed? How many days do you bleed? Do you bleed for 1 day, 2, 3, 4, 5, 6, 7? Actually, I'm aiming at 7 because it is actually the maximum that is standard. But obviously, there are people who bleed up to 10 days. Okay. So if you bleed up to 10 days, please just put it under that you bleed up to 10 days. Thank you so much, Sister Elsie Dredder. Thank you so much. How you doing? How's your corner? Thank you so much, Princess, for sharing. Thank you so much, Sister Tina, for sharing. Sister Lizette, welcome. Good evening to you. I hope you're doing great. So, if you're just joining us, welcome. Good evening to you. I hope you're doing great. Thank you so much for being here. So, we are asking a question. How many days do you bleed? The reason we're asking this question is because the number of days that you bleed and how heavy or light your bleeding is directly related to your menstruation health. Is directly related to how your menstruation should be. That's why we're asking this question. So if you bleed for 2 days, if you bleed for 3 days, you bleed for 4 days, you bleed for 5 days, you bleed for 6, 7, 8, 9, and even 10 days. Although bleeding after 7 days is abnormal, bleeding from less than 2 days is also not normal. Generally, bleeding between 2 days right up to 7 days is acceptable as the normal days, which if you bleed, it is considered normal. But like we said, there are people who bleed for up to 8, 9, 10 days. Now, this question, I'm also trying to answer. Somebody asked a question that she bleeds for 3 days, but the bleeding is heavy. So I'll be answering it as we are discussing. Sister Tina, please, if you're there, just try and follow up. Generally, if you bleed between 2 to 7 days, it is considered normal. Generally, it is considered normal. But if this bleeding between 2 to 7 days is so heavy, so heavy, that you even see that you feel dizzy, then please, it is important that you get to your doctor. If you bleed between 2 to 7 days, it is considered normal. But if bleeding between 2 to 7 days is causing you, is heavy, that is, it is too heavy, up to when you see that you are actually feeling weak, feeling dizzy because of that, please get to your doctor as soon as possible. There might be something wrong somewhere, please. But if you bleed between 2 to 7 days, it is heavy bird. It is something that you can contaminate, that your body do withstand it. You don't feel any other issue, but you just think that it's heavy. Then it's okay. Nonetheless, whenever you feel that there is something wrong with your menstruation, it could be increase in the bleeding days, it could be increase in the volume, then you should talk with your doctor. Because there is something that we all need to understand, is that by the time you were just 13, when you started flowing, right up till maybe 20, if you were not used to having heavy bleeding, and suddenly you are now 25, your bleeding becomes very heavy, then talk with your doctor. When I say talk with your doctor, I know many people say, no, I don't have a doctor. Okay. If you used to consult, let me quote an example. You are in Moyoka and you used to consult at the district hospital, Moyoka District Hospital, and you have this medical person you used to meet. That is your doctor, right? That's the person you confide in. So you talk with the person, and the person look at the situation. If the person, maybe the person will then look for another colleague that can handle your situation. That is your doctor. So talk with your healthcare provider that you always consult with when you have an issue. That's what we are talking about here. But people who are overseas, who have individual doctors. Obviously, you can consult with your doctor, with your doctor that you consult with daily. So, if you bleed between 2 to 7 days, is normal. But if this bleeding between 2 to 7 days becomes too heavy that you feel somehow dizzy, please get to your doctor. Another thing, if normally when you were 13, that is the very first time you saw your period, your bleeding was not that heavy. And now you are 25, you're 26, you're 27, you're 28, you're 29, you're 30. Your bleeding becomes very heavy. Please get to your doctor. So, Sister Tina, if this bleeding you're talking about, this heavy bleeding, if it's not something that you used to have it before, meaning that your bleeding was not that heavy, and now you see that there is an increase in the volume of your bleeding, please get to your doctor. Okay, consult. Consult, please. All right, consult with your doctor. There could be something wrong somewhere. It also goes with those who used to have their bleeding. They know, okay, now I'm going to change maybe 2 parts daily. Let's say you put your parts in the morning, by 12 you change, by 6 you change, okay? Or by 7, that's when you're taking a part in the evening, you change. And then suddenly, you check your part at 12, it's not even so, it's like nothing has even touched it. You check your part by 6, just light blood, which therefore means that the quantity, the volume of the blood that you menstruate, the volume of the bleeding has dropped drastically. After a certain period of time, get to your doctor as well. Get to your doctor as well. So this is what I'm saying. If normally you bleed between 2 to 7 days, 2 to 7 days are considered normal. But if you bleed between 2 to 7 days, which are considered normal, and suddenly your bleeding becomes heavier than normal, than what you used to have, or lighter than what you used to have, get to your doctor. So to my sister Tina, if normally used to bleed for 3 days, but it was not heavy, and now it is heavy, please get to your doctor. There are a lot of reasons for heavy menstruation, and some of them are not good at all. Some of them are not good. It could be fibroid. It's possible that you could be bleeding like that is fibroid. Yeah. So they are not good. You could have even other issues with your womb. That's with your uterus. That's causing you to bleed. So please, if this is sudden, get to your doctor. Please, if you have any other question, you go ahead as we discuss. If you're just joining us, good evening and welcome. Thank you so much for being here. Please help share this video out there and let us know how many days do you bleed and how heavy is your bleeding. How many days do you bleed? Do you bleed for 1 day, 2 days, 3 days, 4 days, 5 days, 6 days, or 7 days? Or even above that, let us know in the comment section. Thank you so much. Good evening to you. I hope you're enjoying the evening. So let us know, how many days do you bleed? Let us know. Let us know. Do you bleed for 1, 2, 3, 4, 5, 6, 7? So like I said, between 2 to 7 is normal, but it will depend on how heavy it is now or how consistent has the bleeding been. Please, if you're just joining, welcome. Please don't forget to share us out. Share this video, please. And Sister Kelinda, welcome. Kelinzia. Sister Kelinzia, welcome. Good evening to you. I hope you're doing great. Thank you so much for being here. So if you're just joining us, welcome. Good evening to you. I hope you all are doing great. Please don't forget to share this video out. Don't forget to share this video out and invite your friends to join us. Thank you so much. So we are asking a question to our ladies. How many days do you bleed? Your menstruation days. Do you bleed just 1 day, 2 days, 3 days, 4 days, 5 days, 6 days, 7 days? Or do you bleed above 7 days? How many days do you bleed? That's the question, please. How many days do you bleed? That is the question. If you're just joining us, welcome. Thank you so much for being here. May God bless you. Please don't forget to share this video out. So, like I said from the beginning, your menstruation, to understand your menstruation, to understand the health of your menstruation. Hey, Sister Fideline, welcome. Thank you so much for being here. To understand how healthy your menstruation is, you need to understand how many days you menstruate, how heavy is your menstruation, what is the color of your menstruation, and how light is your menstruation as well, how consistent has your menstruation been, what is the texture of your menstruation, all of that. But for now, we are just asking, how many days do you menstruate, and is your menstruation heavy or it is light, and is that how your menstruation has been? That's what we are asking. So if you're joining us, welcome. Thank you so much for being here. Please don't forget to share this video out. Just let us know in the comment section, how many days do you menstruate? Is it 1 day, 2 days, 3 days, 4 days, 5 days, 6 days, or 7 days, or even above that? Let us know in the comment section. How many days do you menstruate? The biggest name, good evening and welcome. Thank you so much for being here. I hope Madam is there watching. If Madam is not there, please, I hope you're judging for her. So we are asking our ladies, how many days do you menstruate? The reason we're asking this question is because your menstruation is directly how heavy you menstruate, how many days you menstruate is directly related to your own health, to your female health or your women's health in general. So if you menstruate for 2 to 7 days, generally is considered normal. But some people menstruate above 7 days. And that is how they have been menstruating since probably they were born. Since they started seeing their menses, and it's quite normal for them. So some people menstruate for 8 days. Because since they started seeing their menses, they were menstruating for that, and it has been like that for this while. If you are that person, you're menstruating for 3 days, and suddenly you start menstruating for 7 days, please get to your doctor. That is a change. Now, this change could be normal, but let your doctor confirm to you that it is normal. So, if you're somebody, your menstruation was, let me say, you were using just 1 pad daily, but now you're using 3 pads daily, get to your doctor. It could be normal, but it is important that your doctor confirm that this is normal. If you're somebody, hey, Sister Victoria, good evening and welcome. Thank you so much for being here. Please, if you're just joining us, welcome. Good evening to you. Don't forget to share this video, please. Don't forget to share to your WhatsApp status, even to your other groups, to your other friends. This is video that we all need to share as ladies in order to pick up something from here. Because this question I'm asking, it affects every woman unless you're above 60, meaning that you don't longer menstruate. But once you are you've attained puberty, right up to maybe 50, 55, this particular discussion is for you. Because there are ladies that will also menstruate for up to 7 days when they were normally menstruating for 2, 3 days, right? But now they menstruate to 7 days. It is normal. It's normal for them because maybe they are almost getting to menopause. Maybe they are perimenopause where you have scarcity of menses, but it might come and it takes a longer period of time. It's same as for somebody who is also getting to menopause and the menses is gradually reducing, which therefore means you may stay for 3 months, you don't see it, and then stay for 6 months, you don't see it, and then suddenly the thing disappears. God is a wonderful God, and He's the finest biologist. God knows everything. So, if you're just joining us as a lady, welcome. Thank you so much. I really do hope that you are enjoying the discussion. So, we are asking, how many days do you menstruate? Do you menstruate for 1 day, 2 days, 3 days, 4 days, 5 days, 6 days, or 7 days? How many days do you menstruate? Please put in the comment section. Thank you. Okay, welcome back, everyone. I hope we all are doing great. For those who have been following, thank you so much for following. Please don't forget to share our video. Sister Vanessa, thank you so much for sharing. I really do appreciate. So we're asking a question: how many days do you menstruate? How many days do you menstruate? The menstruation cycle for a lady is actually something that has to do a lot with the health. If you have something that is going wrong with your health, you might likely see it. You might likely notice your menstruation behaving in a way that is not normal. Menstruating between 2 to 7 days is generally accepted as normal, but there are many other issues that might come up. If you menstruate for 2 days, it's okay. But let me say you used to menstruate for 5 days and suddenly you drop to 2 days. Is that okay? Certainly not. Please, although 2 days is normal in the sense that 2 days falls between the normal time accepted. But you used to menstruate for 5 days, but now it's 2 days. So get to your doctor. Your doctor should confirm to you if it's just okay for you to have this drop, maybe due to other issues that you have, or due to other changes that you have in your body. Your doctor should be the one to confirm to you. If you used to menstruate for 7 days and suddenly it drops down to 3, get to your doctor as well. If you used to menstruate just for 2 days and now it is now 7, get to your doctor. It could be normal, it could be abnormal, but get to your doctor. Your doctor will actually confirm to you if this is normal or abnormal. Please, if you have any question, you go ahead and ask your question. All questions concerning the menstrual cycle will be answered. I know we're not talking about menstrual cycle in general, but if you have a question about your menstruation, please go ahead and ask. So, the length of your bleeding, the number of days that you bleed, the intensity of your bleeding, the consistency of your bleeding, all of that plays a vital role, including the color of your menstruation. With this presentation here, that is, it was not a presentation, it was a post, just a post, yeah, on colors of menstruation. What does it imply? If you see this color, what does it mean? If you see this color, what does it mean? If you see this color, what does it mean? So, but generally, most of the colors that you see are all okay. We are just trying to say that make sure you're vigilant to understand if you have some changes within your cycle. Your cycle plays a vital role when it has to do with your health as a lady. So if you menstruate for 5 days and now it is 2 days, please get to your doctor. If you menstruate for 2 days and now you're menstruating for 5 days, please get to your doctor as well. But we should not mix things up. There are a lot of people who have issues with their menstruation. Let me say your cycle is a 28-day cycle, which therefore means that every after 28 days you see your period. Every after 28 days you see your period. Every after 28 days you see your period. And suddenly, instead of 28 days, you now see your period after 35 days. Certainly that's not normal, right? Yeah, it is not normal. But if that is the only cycle you have 35 days, then you should not bother yourself too much. You should bother yourself if you used to see your period every after 28 days and then suddenly it changes, it goes to 35, the next one 34, the next one back to 35, the next one back to 28, then you should get to your doctor. Yes, there's something wrong with your cycle there. That's the irregular nature of your cycle. Coming back to the topic we are talking about. If normally you used to bleed for 3 days as a lady, you menstruate first day, second day, third day, everything stopped, no more bleeding as a lady. Then suddenly you start bleeding for 6 days, 7 days, and it is heavy. And that bleeding comes just for one cycle. I don't think you worry yourself there. You should not worry yourself there. Unless you've done something. Yeah. Maybe you had an abortion. Maybe you had a miscarriage. Then that's a different scenario. But if you have a change in your number of days that you menstruate just for one cycle, then do not bother yourself. Bother yourself if you see that change like that, and the next month you still see the same change, which therefore means you used to have your flow for 3 days, then suddenly it goes to 6, 7. The next month you see it now for 6 days. Next month I see it now for 7 days. Get to your doctor. But take note, I have not said that you should not get to your doctor if the bleeding is too heavy. You used to have it for 3 days and then now it comes for 5 days. But these 5 days, the bleeding is too heavy. Meaning that you're having serious heavy bleeding. Please, in this scenario, get to your doctor immediately, because serious bleeding could mean that there is heavy bleeding, could mean that there's something dangerous happening to your womb, to your female reproductive organs in general. It could be maybe right at the level of your ovaries even. So Don't get mixed up here. If you see you're bleeding every 3 days or 4 days, suddenly you have a change, and that change is just for 1 month, you don't have to bother. But bother if this change we are talking about for this 1 month is too heavy that you think that no, you're getting maybe even weak because of it. Get to your doctor immediately. Get to your doctor immediately. This could be something dangerous. I hope it is clear. Please, if you've understood what I'm saying, just answer yes in the comment section. And please, if you have any question, you go ahead and ask your question, such that this live show can be wrapped up. I've exhausted the bit I had for today for our ladies. If you have a question, please go ahead. If you have a question, please go ahead. So if no question, I'll be wrapping up. So we are looking at menstruation, and principally I was asking, how many days do you bleed? Do you bleed for 1 day, 2 days, 3 days, 4 days, 5 days, 6 days, or 7 days? And I say, if you bleed between 2 to 7 days, it's considered normal. If you bleed below 2 days, it's considered abnormal, please. Below 2 days is considered abnormal. Yes. Any person bleed below 2 days is considered abnormal. If you bleed above 7 days, it's still considered abnormal. Okay, so if you bleed just 1 day, 1 day is considered abnormal. If you bleed for 6, 7 days, 8, 9, 10 days, is also considered abnormal. But remember, I said there are people who also have that abnormal value, and it's normal for them. So do not always think that because somebody says mine is for 8 days, it therefore means normally 8 days is abnormal, but there are people that were born to just bleed for longer days than you. But generally it's between 2 to 7 days. So that's the first thing. If you bleed between 2 to 7 days, it's considered normal. Now the next thing is, how heavy is your bleeding? That's the next thing. How heavy is your bleeding? If that bleeding is normally the one that you change your pad, let me say twice a day, and then suddenly you start changing your pad you start changing your pad 3 times daily, try to get to your doctor. Please, we should make use of the hospital. I know most of the times we think that hospital is when you have serious fever. No, your menstruation color alone should get you to your doctor. Just go and consult, see a doctor, even if, because at times we are thinking that, oh, we must be asked to run series of tests where they are very expensive. No, get to your doctor. When you think that something is not normal, get to your doctor immediately. He or she will be the one to confirm if actually what you have is normal or is completely abnormal. So we are just like giving a hint. We are not deciding anything here. Please always get to your doctor. Hey, Mama Patrice, welcome. Thank you so much. Thank you so much for being here, Mama Patricia. Thank you so much. Okay, Sister Casey, I say you bleed for 5 days. Yeah, 5 days is okay. If you bleed for 5 days, it's okay. Like I said, between 2 to 7 days is considered normal. If you bleed above 7 days, is considered abnormal. But there are people who bleed above 7 days, so it depends on how your system has been. But if you notice that there is a change, that normally, like most people say,